A very good afternoon to one and all present here. Today I'll be talking about early interventions for early childhood caries. Now, if you can see the clinical image here, we often as a pediatric dentist encounter cavitated lesions, and we seldomly encounter cases like this, which are non-cavitated lesions. Now, when it comes to early interventions for ECC, one needs to ask the following important questions. What are the most dominant risk factors for ECC? Are this risk factor preventable? Can we arrest initial stages of ECC effectively? What intervention really works? Now, this paper by Coffin and his colleagues on HAS ECC proposes a new classification called hypoplasia-associated severe early childhood caries. Now, another systematic review by Kritika et al. Reaffirms that enamel defects are indeed one of the major risk factors for early childhood caries. Following that, a recent umbrella review and case control study also reaffirms the enamel defect being one of the major factors. Now, the principal rules are thorough infant examination and identification of enamel defects and enamel hypoplasia. To evaluate enamel, a thorough wiping of enamel with cotton and gauze paste is advised. And whenever a parent comes for the first dental visit of the child, we are bound to provide anticipatory guidance on oral hygiene, dietary and feeding practices, fluoride adequacy, dental development, oral habits, and trauma prevention. Now, in PedoPlanet, we practice this preliminary protocol as early intervention, and it has been very successful. We have done several cases, but today I present to you just 2 cases with the longest follow-up. Now, this patient, Mr. Said Uzair Ahmed, he was an infant at first dental visit to our clinic. He was barely 15 months, and nighttime feeding practices was present at the time of visit. Now, as a management, we follow the protocol as immediate cessation of sleep time feeding practices, and we advise disciplined infant oral health care measures. And we asked him to report after cessation of nighttime feeding, and we applied 3 to 4 varnish application in interval of 1 to 2 years in 2 weeks in between. Now, as you can see the clinical pictures, the first picture was taken on March 2018 when the patient first reported to us. If you can see in the cervical region, you'll see a white chalky appearance, which denotes the enamel defects or enamel hypoplasia. In February 2021, if you can see, the caries has not still progressed, and the chalky white appearance is gone. The enamel surface seems to be hardened, and thus, intervening the progression of the ECC into a full-blown disease. Now, the second case is Mr. Advik. The age of the infant was 18 months at the first visit to our clinic, and nighttime feeding practices just stopped when the infant reported to our clinic. So again, we advised him for immediate cessation of sleep time feeding practices. Mind here, we're not advising to stop feeding, but we are only advising to stop feeding during sleep. So when the child goes to bed, he has a clean mouth, and when the child wakes up, he has still a clean mouth. Again, we advise disciplined infant oral healthcare measures. And again, 3 to 4 varnish application in interval of 1 to 2 weeks in between was applied. Now, coming to the clinical measures, as you can see, November 2018, again in the cervical region, you see a non-cavitated lesion present there. In Feb 2021, if you can see, again, the enamel surface is hardened. There is no further caries progression, and the disease was successfully intervened early. Now, do we have enough evidences about this preliminary protocol? No, we do not have enough evidences, but currently at Center for Early Childhood Caries, there are studies going on to reaffirm this protocol. Now, in this study, in this policy statement published by AAP by Steve Holf, he tells us that fluoride vanishes when applied as soon as the tooth erupt in these indigenous communities where ACC is very highly prevalent. Indeed helped to arrest the early childhood caries progression. Now, this Cochrane review on fluoride varnishes for preventing dental caries further reaffirms and reconfirms that fluoride varnishes do help in arresting dental caries in children. Now, the take-home messages I would like the audience to know is that even after fluoride varnish application, we need to emphasize on cessation of the sleep time feeding practices. We need to emphasize the parent for vigorous infant cleaning measures. And the first step towards achieving this is to identify what are enamel defects. So thank you very much.